You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial rejuvenation. My first guest is a board-certified plastic surgeon, probably one of the busiest guys in the Coachella Valley. And if you're unhappy with the way you are aging, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of facial rejuvenation. Brand new show today. With us, we have board-certified plastic surgeon, Dr. Mo Zakhireh. Dr. Zakhireh, welcome to the program.
Hey, Randy, good to see you.
Always a pleasure to have you on.
Thank you very much.
A lot of new stuff going on, by the way. You recently purchased, I understand, the Cosmetic Surgery Institute.
Right.
It's all yours now. Good. Same people, though, right?
Yes. We felt that it was very important to keep the same staff, to have the same chemistry, because the chemistry there is awesome. Now,
for those people in this town that don't know you, let's talk a little bit about your background, your training. Very impressive, by the way. Board-certified plastic surgeon. Let's start there.
Sure. I did my general surgery training at Harbor UCLA, and then I did my plastic surgery fellowship at the University of Utah, and then I was honored when they asked me to stay on as a professor at the University of Utah.
You know, today's topic, we said what you need to know if you're considering any type of facial rejuvenation. What type of patients, by the way, and before we get into that, what type of patients do you see there?
I do facial rejuvenation, I do breast work, I do augmentation, reduction, breast lift, I do tummy tucks and liposuctions.
Now we're going to move into the face in a moment, but I want to get your opinion on this. A case for cosmetic surgery, plastic surgery, who should get it? Because it's becoming mainstream.
That's a very important question. When somebody starts to look in the mirror, look at themselves, and they start to say, God, you know what, I look tired. Or I get a lot of patients, they come in, they're like, you know what, I can't take pictures because I don't want to be in a picture because I look so tired.
Is that what they say to you?
Oh yeah, I look tired next to my husband. So that sort of thing, that scenario happens every single day. And the other thing is that we get a lot of people coming in, they're like, well, you know, I'm older in the workforce now, you know, I'm a realtor or I'm a bank executive or whatever. We have younger people coming up the ladder, a lot of competition, you know, and I just want to look younger and fresher so that I can be more confident about myself.
Do you ever have people that actually get a facelift? For an event?
Oh, gosh.
For a wedding? Really?
Oh, yes. We have people coming in all the time for class reunions, for weddings.
And they'll get a facelift?
Oh, they get the whole shebang sometimes.
What about the single crowd? Women that are faced, or even men that for the first time, they're single. And they're in their 40s, mid-40s, 50s. 50s young today.
It's absolutely true. And now the technology is there to actually do something good for these people. And it's very interesting because a lot of people in their 40s now are finding themselves single again. And so what they have to do is they feel like they need like a pick-me-up, like a perk to start going out, you know. And
but the fear, though, is, and I hear this all the time, is they don't want to look different. They don't want to look done. You know, they always refer to Newport Beach as that done look.
It's not a concern. It's a fear. You know, they come in, they're like, you know, I don't want to have that wind-blown look and things like that. And we can discuss that, but there are reasons as to why that happens. A lot of times...
Is it really in the hands of the surgeon?
Absolutely.
Or just the healing process?
No. It is 99% in the hands of the surgeon.
This is interesting to me.
Okay, so number one, what happens is that a lot of surgeons do not tighten the muscles of the face and the neck, Randy. It's very important. What they do is they just lift up the skin, pull the skin, and just cut off that extra skin of the face and the neck, and they rely on the skin to carry all the tension on the face.
It is hard to believe that they are just pulling skin. Oh, you're saying it's done all the time? It's
done all the time. 90% of the time, that's what people do.
What do you call it? I mean, when you're addressing the muscles.
No.
What's it called in the world of plastic surgery?
Well, I just call it doing a facelift the right way.
Okay. All right.
You know, tightening the muscles. You know, you gotta address the soft tissues of the face. And the secret is when you tighten the muscles, you gotta tighten it with a Here we go, a 45-degree vector.
Nice.
You gotta tighten it up this way. And I know that you always give me a hard time about this, but that
because I never knew what vector meant in the old days, vector of pull.
That 45-degree direction,
it's the direction
Randy,
you pull it.
The direction of the pull is very important. Now, 45 degrees is actually the sweet angle in nature.
Sweet angle.
You talk to a botanist, you talk to an architect, you talk to a good surgeon, you know, you talk to a lot of different fields, and people will tell you about that 45-degree sweet angle. What happens is when you touch things up at 45 degrees, like the petals of a flower and relative to each other, it looks cosmetically pleasing to the eye. The majority of surgeons, 99% of surgeons, are still back in the old days where they're doing skin pulls, okay? Here's the deal. A lot of people are not even there tightening muscles, okay? I'm a step beyond. What happens is that the majority of facelifts is done pulling back, so you're talking about 2 dimensions only, okay? With my facelifts, I'm also concentrating on fat grafting, which is very important. I take the fat.
So a combination of procedures.
Oh, you bet. I take the fat, I harvest it from here, okay, and then I graft it to the forehead, around the eyes, around the rim that gets hollow, into the cheekbones, nasolabial folds, even the lips. Okay? What happens then is you're looking at a 3-dimensional lift. You're not only tightening things this way, but you're also augmenting the tissues this way. What happens is that our soft tissues of our face in our 20s and 30s are very full, pouty, supple cheekbones, you know, the lips, things like that. As we age...
There's a lot of talk right now. Adding fillers. Fillers only. That's all you need, Randy.
Don't get me wrong. I mean, we use Restylane like for the finishing touches, let's say around the face. Let's say if you have the small lines and things like that, you know, I always incorporate Restylane with the fat. But the mainstay is the fat, because the fat...
So real fat. Okay.
Because the fat lives and it becomes permanent, and it feeds the skin. The pores get smaller, the skin gets tighter and healthier. I'll show you
in
some
combination
of the
with a facelift.
Oh yeah, you got to do it in combination with the facelift, you know. And I always tell my patients,
aren't you afraid to let out your secrets? All the local surgeons will start doing this.
You know, when I used to train residents at the University of Utah, I knew who had good hands and who didn't. The residents, a lot of residents rotated under me, a lot of medical students, and I knew who was a true surgeon.
Define true surgeon, by the way.
Some people just have natural hands.
Because you were the professor and you could eyeball it, you could see it.
Right, yeah.
Some people have
natural hands, and some people can judge, you know. For me, it's a work of art, you know, because I've always had the eye, you know. I mean, I'm a published nature photographer. I used to do a lot of photography in Utah, you know, and my pictures, you know, have been in magazines. So I've always had the eye, and I've always been very gentle with the tissues.
That's why you're the hot facelift guy in this town.
Well,
I mean, that's what they say. I mean, that's what they say.
Well, thanks.
I mean, even Newport Beach people, they're coming here for their faceless.
Yeah, but then the other issue is that I really care about what I do. This is my passion. For me, this is fun. It's really neat to go to work every day and do something fun.
Okay.
For me, it's just my passion. I just, you know, come in, have fun, do my work, treat my patients well. That's what it's all about.
Okay, good. Now, we have some photos. We're going to take a quick break. We come back. These are great.
Thanks.
Great photos, by the way.
Thank
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez, and we're talking today with board-certified plastic surgeon Dr. Mo Zakhireh about what you need to know if you're considering any type of facial rejuvenation. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. All new shows today. With us we have Dr. Mo Zakhireh, board-certified plastic surgeon, and today's topic is what you need to know if you're considering any type of facial rejuvenation. Okay, so you brought some photos.
Yes, but I'm sorry, Randy. Before we touch upon the photos, there's a couple of more points that I need to cover with you.
You're kind of feisty today, aren't you? We've had you on the show a lot of times, so this is good.
Well, we had that early morning workout, so
ran into you at the gym. That's right.
Yeah, it was good to see you there. Now, what happens is covering the Botox, selectively doing Botox. The other thing that I like to do is at the same time that we're doing Botox, I like to do a little bit of Botox just on the pink edge of the lips. Okay, what happens is the Botox, you know, we have a circular muscle around our mouth. The Botox just relaxes the inside edge of that muscle, and it gets rid a lot of those lines.
Really, for the lines here.
Mm-hmm. And also the other thing that it does is a lot of people, you notice...
But you do before the facelift.
Yes, it gives a better shape to the lip as far as the fat grafting is concerned. Okay. Now, the finishing touches after all this is the erbium cyton laser that we do. Very important. Okay. There are different ways of resurfacing the skin. A lot of people, especially in the desert, they get a lot of sun damage. So we resurface them with the erbium cyton laser.
The day of also the facelift?
Yes, the day of the facelift. And then a lot of people get that crepiness under their eyes.
Yeah.
Where their skin gets kind of wax paper thin and gets really kind of small, you know, wrinkles. That laser smoothens out those wrinkles. But it's very important because the erbium cyton laser is a high quality laser that does its job without damaging the skin, so that it doesn't rob the patient of their natural pigment, of their natural color texture of their skin. Whereas,
because I've been told if you only do it under the eyes, you're going to get patches or discoloration. It won't match the rest of your face. That's not true if done correctly?
What happens is that's true because of either phenol peels or because of the carbon dioxide laser. The carbon dioxide laser, believe it or not,
CO2?
is CO2, yes. It's still in use, and I'll tell you why. Because people purchase it. It's a very expensive laser. They realize it's...
You're smirking right now.
Well, it is what it is.
You're giving us the inside scoop here.
Right, and so you see a lot of patients walking around the valley here with that white line, and their skin above that white line is bleached. It has that milky white sheen.
Because of the old CO2 laser.
Because of the old CO2 laser. And it's still in use.
So moving on to your technique. Okay, so you do a cyton erbium laser around the eyes.
Yes.
And
what happens is, you know, so I do the face and neck lift, tightening the muscles and things like that. And, you know, then the rest of it is sort of, for me, it's icing on the cake. Let's say you bake a really good chocolate cake, but without that frosting, it's not right, you know? So with that said, let's just cover some patients. The facelift show is a funny show because we do a lot of high-end clientele, a lot of VIPs, especially in this community, and nobody wants their pictures on camera,
TV,
you know? So the thing is that there's a lot of consent issues. So I have very selected patients, you know, that I talk about, one of which is my mom. Now,
by the way, your mother, she has a high-end salon in this town, right?
Yeah, actually.
Hairstylist.
Yeah, thanks for touching upon that. My mom opened an Aveda salon. It's called Pure Hair Studio, and it's on Bob Hope and Dinah Shore. And she opened it probably last November. And I actually got my haircut there.
That's where you get your haircut
for the show. Yeah.
All right. Her mother. These are her photos.
Yes. So my mom, you know, she had the deep nasolabial folds. The soft tissues of her face had fallen. She was developing that crepey neck, the neck banding, and she was very hollow under her eyes. Now, Randy, I want to draw your attention to a few things. Notice the jowls. Notice the downturned, kind of sad face. That's because the downturned corner of the lips.
So around the jowls,
the sad eyes, you know, and also notice the sun damage on the skin, okay? The quality of the skin before surgery, okay? Now, after surgery, you know, what you notice is that this person, first of all, this person doesn't look done. If you saw her on the street, you would never know that they've had anything done.
It's beautiful, by the way. Beautiful work.
Appreciate it.
Very pretty.
So the neck has been lifted, the crepey neck is gone, the jawline is very well defined, the jowls
when I put
are
the
gone.
side by side, I mean, it's a huge difference. She looks 15. She looks happy, by the way.
Yes, absolutely. And you know what? That's very important that you bring that up, because let me tell you, it's very stressful to operate on family members, but I have the luxury of watching them blossom after the surgery. And before surgery, my mom looked tired and she felt tired. After the surgery, she acts like a young, vibrant woman. She has more energy. She works out. She goes hiking. She's laughing a lot. She's smiling.
And you think there's a connection, though, with a facelift?
Absolutely. Let me tell you why. Let me tell you why. Subconsciously, it registers when you look in the mirror. When you look in the mirror every time, you look tired, so you feel tired, you are old.
Interesting.
Okay? And after the surgery, it's just like...
This is what they tell you. It's not just your mother, but this is what they say to you?
Oh, gosh, you know, the patients carry themselves differently. It's a joy to watch the patients come into the office. Their makeup changes, their hairstyle changes, their clothing changes. They come in, they're just smiling, they're happy. It's amazing.
Now, without sounding shallow or superficial or whatever, when I look at your mother in the before, that's what she looks like. Somebody's mother. Afterwards, Looks like a beautiful woman. I mean, it's very pretty.
Yeah, and I
She's gotta be
actually
thrilled about that.
I've gone back. Well, I shouldn't say how old she is, but I will. She's 62.
She does not look like a 62-year-old.
Thanks. That means a lot.
You know,
I appreciate it.
50s. Well, that's good. Good for you.
Oh, and by the way, the one more thing I wanted to touch upon is the quality of her skin. Now, you know, a lot of before and after pictures, the patients after have makeup on. She doesn't have any makeup. The quality of her skin, very important. Her skin just looks healthy.
What, laser, IPL?
Well, it's the combination of the fat grafting. Remember, I touched upon the fat grafting.
So with your mother, you put fat around her forehead or eyes?
I put fat on the forehead, temples, around the eyes. I am even putting fat on the dorsum of the nose, underneath the skin of the nose. It's very important.
This was her own fat, though?
Yes, her own fat.
So your mother got a facelift, fat to the face. And you do this on pretty much all your facelift patients now?
Yes. Yes.
Is that rare? And that is rare, you say? This combination of procedures, the way you're doing it?
It is very rare. I don't know of anybody else that's doing it. What you have to realize is the physiology of our face, especially a woman's face, is such that as women age and they go through hormonal changes, the fat content in their face decreases. And that's also why they get the sort of the flat lips, and they get some of the lines there in the lips, because they lose that volume, they lose that poutiness.
So these implants, these...
Right. So
but logically it makes sense, because you drape, for bags under the eyes, they drape right over it and give a great look.
Exactly. But what happens is over the next few years, a lot of these cheek implants, the fat around them gets metabolized because of the aging process, so the cheek implants are notable.
Like bumps.
They sit right there like bumps.
Interesting.
The edges are notable. And so, you know, we've had...
Do you see this? I mean, I don't notice this kind of stuff. But when you're out, do you say, oh boy, cheek implants?
You know, it's funny that you ask. When I'm out of the office, I turn my brain off. You know, unless somebody has like a big mole or a big lipoma or something, but I turn my brain off. Somebody will say, God, did you notice that botched nose job? And I go, no. They're like, what's wrong with you? You know, I think that could be exhausting, and I'm so lucky because I can turn it off.
Okay.
So let me tell you this though, when these people come in with the cheek implants.
Oh, so they come to you on a consult?
Yes.
Okay,
they're
I
like,
got it.
well, you know, my cheek implant, the fat around it has disappeared. What do I do? We used to actually take these cheek implants out and do fat grafting around them, but now we've got enough experience with these to where we just put fat grafting around the cheek implant and we blend it back in. We put fat over the cheek implant and all around it so that it blends in and the patient looks healthy again, and the cheek implant, you know, doesn't stand out anymore.
Okay.
Very important.
So keys to a natural facelift. Give us a recap. In your hands.
Keys to a natural facelift: tightening the muscles, not necessarily taking skin, just tightening the muscles in a 45-degree vector. And also, Randy, you got to preserve the earlobe, by the way. People come in with the natural-looking earlobes, and the biggest mistake I see, surgeons tack down that earlobe, and then scar tissue pulls as it heals, it shortens, so that earlobe pulls down and they get that pixie ear. Dead giveaway of a facelift.
Can you fix those things?
Hate it. Sure, yeah, we can fix it. It's difficult, but it's fixable. So, and then, tightening the muscles in a 45-degree vector, and then the fat grafting, boy, so important. The
combination of fat grafting.
Combination of fat grafting.
I mean, knowing what you know now, for you to do a facelift without the fat grafting, would that just, not give you the result you want?
Absolutely not.
So they always go together, in your opinion.
Yes, and it's very important because I critique my own pictures. Okay, so let's say I go back and look at pictures of facelifts that I did in the year 2000 to 2008. My technique, because of the fat grafting technique that I'm using now, my technique has changed so much, Randy. And
you're that much better now.
And I used to have good results then, but I have excellent results now.
Do you think you're one of the best guys? I know it's tough to brag about yourself, but do you secretly think like you're one of the best guys worldwide when it comes to face?
I do, but you'll never know it. If you ever talk to me, I'm not arrogant
you're a down-to-earth
guy.
Know, that's like, right.
If you ever meet me somewhere outside the office, you won't even know I'm a plastic surgeon. That's the whole thing. The thing is I think I'm not, maybe not the best, but I'm pretty darn good because I think about this all the time.
Are you a bit of a perfectionist when it comes to the facelift?
Yeah. Oh God, yeah. The thing is everybody tells me, I'm a Virgo. And that
okay.
Why?
Well, that explains a lot. No, I'm kidding. I don't follow that. But go ahead.
So
you're a Virgo. Okay.
I am a perfectionist, and I beat myself up so bad. It's awful. But, you know, I mean, that's like perfect for what I'm doing, because I'm always striving for perfection.
All right, all right. And you also said, I love this quote, that the best work goes unnoticed, and because nobody knows that it was done.
It has to. Absolutely right. I don't ever want my patients to be approached and say, oh, you look good, you had a facelift. Oh, you look good, you had a tummy tuck. No. Or breast aug. No, I don't want that. I want people to approach them and say, you look good. Have you been on vacation? You look well rested. So this patient, when she came in, you know, she had just a little bit of jowls.
That's a beautiful woman to begin with.
Yes, absolutely. Very attractive woman. Just a tiny bit of jowls, a little bit of banding, okay, a little bit of sun damage, all right, and she was just beginning to get hollow around the eyes, all right. So what we did is, again, just went in, tightened the muscles with a 45-degree vector. We did a lot of fat grafting to her face, a lot of the hollowing areas here, the forehead area, the cheekbones, resculpted the cheekbones for her. And again, Randy, we did this knowing that we would have done Botox on her a week before, because we didn't want her muscles to be fighting us. Okay, very important.
Interesting.
Tiny bit of fat to her lips, just to give that pout back, not to make her look artificial.
I mean, this is a beautiful look, by the way. I mean, she was pretty before, but when you look at the straight on before and after, it looks like a model.
Yes.
I mean, she should model. Does she model?
She does model, yes.
Okay.
And it's interesting that, you know, that you say that, because you know, and by the way, she healed up so quickly. She healed up after 2 weeks. She was out and about. And
I'm reading here, 5 weeks after.
Yeah.
Neck lift, fat full laser.
Right. And she was so funny, because, you know, she's the kind of person that when she laughs, it's just so contagious. I just love to hear her laugh. And she's so happy now. She comes in and she's laughing. She's got a great sense of humor. She's like, yeah, the other day, you know, I went to the movies and I got carded.
Okay.
I was like, okay, that's interesting.
I mean, this is great work.
Thank
they
you.
should show, you know, and I go to the American Board of Facial Plastic meetings and plastic meetings. This is one of those, you know, your mother and her, these are the kind that need to be shown up on the board.
Thank you, Randy. That
I mean,
means a
it's
lot.
good stuff. And I'm trying not to endorse you, by the way.
Okay, I know we're running out of time, but please, if you don't mind, do I have time?
Okay,
for
one more. We have one.
Great. Now, here's a woman, one of my dear patients. She came in and she had been taking care of her daughter who's ill, okay? And she was so sad. She was like, you know, I just feel like I've been beaten up by life. And in the before pictures, you see that she just looks sad. She's got the downturned corner of the eyes.
Big bags under her eyes.
Right, big bags under her eyes. She just looks sad, downturned corner of her mouth, big jowls.
Oh, that's right. The corner of her mouth turns down.
Yeah, really, just really sad. And she said, can you help me, you know? And she was originally looking for a little bit of a laser, a little bit of, you know, fat grafting. I just told her straight out. I'm very honest to my patients. I said, you know, if I do just laser and fat grafting on you, you're not going to be happy, you know?
All right.
I need to do a facelift and the whole Monty. And, you know, other people would not say that bluntly, but it is what it is. I just tell it like it is.
All right.
And so she actually went home and thought about it. She called me back. She said, I really liked your honesty. I have a lot of respect for you. Let's do it. So we did her face and neck lift, and again, fat grafting and erbium laser, and also
huge difference under the eyes, by the way. I mean, anybody that looks at, you know, we put this up. It's very nice under the eyes.
You know what?
Huge difference.
I'm glad that you point that out. I did a lot of work under her eyes because she had those big puffy eyes. The patients
That's a tricky area, right?
It is very tricky. The patients that come in with the big puffy eyes, they got the puffiness, but then they got a hollowing underneath.
Yeah.
So you got the puffiness up here, right? And then you got the hollowing underneath. You got to take that puffiness down, but then you got to fill in the hollowing.
Right. So you did that with fat, her own fat.
Right. And again, now when she comes in, her skin, 3 to 6 months out, her skin looks healthier and healthier and healthier. And that's because of the fat grafting.
And she has a very thin face to begin with.
I tightened the muscles of the face.
Yeah.
And
she doesn't look done, as they say.
Exactly.
She could have looked done.
Exactly.
Yeah.
Definitely.
It's good. Good. Final message here, by the way. We're out of time. Somebody, they're not happy with their face. I think we should mention, we invited you on the show today to talk about facelifting. Mm-hmm. But you do everything. I mean,
you gotta go to somebody who has an array of tools to help you. to help rejuvenate you, to help you get that. You know, I think aging gracefully the meaning of aging gracefully has changed.
So a facelift is aging gracefully, you believe?
Done correctly, okay?
Okay.
So that the scars don't show, they don't get that pixie earlobe, the earlobe that's tethered down. They you know, their skin looks good and they don't look pulled, okay? Very important, all right? So to me, this is the definition of aging gracefully. Now, you know, if I had advice to give to anyone when they go see their, you know, plastic surgeon or cosmetic surgeon, you know, I think it's important that that physician have a big portfolio of before and after pictures to refer to. And their portfolio has to be neat, orderly. Their patient pictures have to be, you know, professional looking, you know, standardized with the same background color, things like that. And then the second thing is that I think patients are intelligent enough to, when they walk into the office, they have to feel at home, you know?
You have to like your surgeon, you believe?
Right. You have to, that surgeon has to be caring. You have to know that they're going to be caring for you as if you're their family member.
Okay, good.
Bottom line, that's what it comes down to.
You have 2 plastic guys, by the way. 2 plastic surgeons under one roof now.
Yes, we recruited.
They're calling you the dream team, by the way.
I know, it's going to be awesome because we have, you know, we're both board certified plastic surgeons, but more importantly, our work is good. We have good hands. We have a good relationship. You know, I think for me, it's very important that people don't have egos.
Now, you're a down-to-earth guy.
I mean, yeah, so that's what it comes down to. We go in, we treat our patients well, you know, we do great surgeries in the operating room, and we have just a great working relationship.
So it all starts with that consult.
Of course.
Find out your options. All right. Well, thank you so much. Always a pleasure to have you on the show.
Good to be here. Thank you,
Glad
Randy.
you came in such a good mood today.
Thanks.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.